You're listening to the Mother to Baby podcast, medications and more during pregnancy and breastfeeding. Ask the experts with your host, genetic counselor and mom of four, Chris Stallman.
This episode contains evidence-based information that's current as of the day recorded and may change as more data becomes available. To get the very latest information about this topic or other topics in pregnancy and breastfeeding, please contact a mother-to-baby specialist at 866-626-6847, by text at 855-999-3525, or through our website at mothertobaby.org. Welcome to another episode of the Mother to Baby podcast. My name is Chris Stallman, and I am a genetic counselor, a mother of four, and a teratogen information specialist. So what I do is I give information to people about exposures before and during pregnancy, while breastfeeding, and in cases of adoption. And an exposure can be anything. So of course, it could be a medication or a vaccine. It could be an illness. It could be chemicals used at your workplace, or even things that you use every day, like personal cosmetic products. This episode comes at a very special time. So at the time of recording, we are in Birth Defects Awareness Month. And we will be talking in several episodes, not just about birth defects, but also about health across the lifespan. And here with us today is our special guest, Dr. Sarah Verbiest. She has over 25 years of expertise, leadership, and research in maternal, child, and family well-being. She is the director of the Jordan Institute for Families in the University of North Carolina School of Social Work, and the executive director of the Collaborative for Maternal and Infant Health in the UNC School of Medicine. Dr. Verbiest, thank you for being here and welcome to the show.
Thank you so much for having me. And one thing that's not on that description is that I'm also a mom, and I have two children. They're young adults now, but I also have two children.
Thank you for sharing.
So I'm excited to have a conversation today about this topic.
Me too, because this is going to focus on something that we don't always focus on, but certainly is very important. So let's just dive in and talk about preconception health. So health before a person becomes pregnant. What is it?
Well, that's a great question. I think the way you just describe it is the simplest way, is that how healthy and well a person is before they become pregnant is really important. And we know that's important for their own well-being during pregnancy and after they have a baby, as well as for their baby's health and well-being. One thing that I want to make really clear right at the beginning of our conversation, though, are the things that we talk about are things that can maybe reduce the risk that a baby will be born with a birth defect or a problem, but nothing is foolproof. And also, it's not ever a mom's fault when we think about birth defects and what she does before she has a baby and birth defects. I just want to kind of put that right out there. A lot of what we're talking about are things that you can do to really lower some of the risks that might be out there, but you matter and you're doing your best, and that's what counts.
And I really appreciate that, because people are doing their best, and it's hard. It's hard at the best of times. And in my opinion, the last couple of years have not been the easiest.
So they have not.
Oh, it's not just me. Oh, what a relief.
No.
A very welcome reminder. So thank you for that. Since we're talking about birth defects awareness and lowering our risk, what are some of the things people should talk about with their healthcare providers when they're planning a pregnancy?
Well, first of all, I really love, it's great to tell your healthcare provider that you are thinking about becoming pregnant, or that's something that you might like to have in your future, because they are probably not going to ask you. So I think it's really good to start that conversation with them. So that would be a good first step. Some of the things that you would want to talk about and that they would want to talk about are if you have any health conditions, like diabetes, for example. You'll want to talk to your provider about some really good strategies for managing those conditions and really well paid attention to and cared for before you become pregnant. So that would be one conversation that you'd want to have. Your provider will probably ask you about what kinds of medicines that you take. And those might be prescriptions that you have, or those might be things that you can just buy over the counter at a pharmacy. And sometimes it's important to know that if you see maybe a specialist here or a different primary care provider over there, sometimes their medical records don't talk to each other. So it will be really important that you tell your provider all the medications that you might be taking, including if you use any herbal medicines. And it's so important to have this conversation because what sometimes happens is people, when they become pregnant, they kind of panic and they just stop taking all their medicines, and that can be really a problem. So it's awesome to have this conversation before you're pregnant. Some other things that you might talk about are vitamins. So we know that taking a daily vitamin with folic acid is really important. So you might talk to your provider and they might suggest that you start taking a prenatal vitamin, or there may be some other vitamins that they might encourage you to take. They'll also talk to you if you are using tobacco, maybe vaping or smoking, or talk to you about if you're drinking alcohol, and just have a conversation with you about some strategies for cutting back and stopping that. And, that's really hard to do, but it's really good to have that conversation. So that's another example. And they might also talk to you to see, how well are you feeling in your heart, in your head? Like how mentally well do you feel? And do you have a lot of stress? Because there may be some strategies that you could try to help, reduce your stress. So those are some of the things that might be part of that conversation. Some other things that you might want to think about is your relationship with your partner. Have you all been able to have a conversation about how you feel about becoming parents? It's really good to have that conversation with each other. And if that's a hard conversation, then maybe you can get some help to have that conversation. And I think that covers it. The list can feel kind of long, but to be honest, otherwise, it's just really about what are you doing to feel healthy and well, and what that looks like for you is really important.
Absolutely. And I think the reminder about different exposures is so important, because I know when I go to the doctor, inside or outside of pregnancy, and they say, what medications are you taking? My knee-jerk reaction, because I don't take any prescriptions currently, is none. But I take a multivitamin. If I took a supplement or something like that, and you did mention herbal products or other exposures like alcohol or tobacco. And it's so important to remember, even though they might just be asking about medications, it's a good idea to share all of the exposures. That way your healthcare provider has the clearest picture.
Yes, excellent point. And sometimes you might have a conversation with your provider about your family history. And so they may ask if you have other children, you might want to, and those children might have a birth defect or were born preterm. You might want to have a conversation with your provider about that. Or if you had people in your family or you yourself were born with certain conditions, you can sometimes talk to a genetic counselor or your provider, and they can just help you understand what might be ahead so that you can be thinking forward about what that might mean for you. And so I think the idea is that knowledge is power, so that you can make the decisions that you want for yourself and your well-being and your future family.
Agreed. And I'm glad you mentioned previous conditions. You mentioned diabetes earlier. Now, I've had gestational diabetes 2 times, but never diabetes outside of pregnancy. Still, it was important for me to make sure that my provider knew during my pregnancy, because sometimes the suggestions of testing or other things can change based on what had happened in a previous pregnancy.
Yes, that is such a good point. And I think, all of these conversations are so much easier to have when you're not pregnant and have all those extra hormones. There's more options for how you might want to be thinking about things when you're not already pregnant. And I agree, like having those conversations now can also be really reassuring. If you maybe had a birth experience that was scary or hard, it's good to talk about it before you become pregnant again, just because that can also set you up emotionally for feeling maybe more grounded and a little bit less anxious when you become pregnant again.
Absolutely. And thinking about people who have had a child with a birth defect, what are some of the unique postpartum needs for that parent, for that family, and for the child?
Well, I think first and foremost, that I would say that as moms or, parents, we are so good at guilt. Are you good at guilt? I'm good at feeling guilty. I don't know about you.
I'd like to say that I'm an expert at making myself feel guilty. Thank you very much.
I mean, I would like with my one kid, like, I don't know, like he was like 18 and I was like feeling guilty because I don't know, I didn't do something, like I should have read more to them when he was in third grade or something, like, and I had this whole crisis. So we are really good at guilt. And so I think that's the first thing, is to like release that guilt, right? You did the best you could. And it's just, there's just so often people question themselves and want to blame themselves for an outcome and think about, what did I do wrong, right? And that's not a helpful way to talk to yourself. And it can be really harmful. And you're going to do it because that's what people do. But I think it's good to acknowledge that and talk to somebody about that and find some ways to release that, because all moms do the very best that they can. And we can't prevent all, like I said earlier, we can only reduce risks, and that is not a guarantee. So I just want to say, like, first of all, tending to your own emotions and well-being is really important for parents of any baby, but especially a baby that has special needs. And I would say then, really the same, I would give those parents the same advice other than that as I would give any new parent. It's okay to ask for help. It's okay to ask questions. What we have found, we have had a lot of conversations with mothers and parents that have babies in a neonatal intensive care unit. And they are so understandably so focused on their baby that they may not be eating well. They may be in that unit and experiencing a lot of pain, a lot of postpartum symptoms, and really just putting themselves so far at the end because they care so much about the baby. And I guess what I would say is, of course, baby is important, but taking care of yourself, getting some sleep, having a shower, seeing your provider, having your pain treated, that also is part of really being able to care for your baby, and caring for yourself really matters.
Dr. Verbiest, tell us about your work and why it's important.
So I am so passionate about women's health and really health for people of reproductive age. I think that there's people in their 20s and 30s are generally pretty healthy and sometimes get overlooked by the healthcare system and may not be getting all of like the health and care and access to mental health that they need just for themselves as people. So I'm just really a big fan of people having access to really good healthcare and access to mental health support, and also access to like things around them so that they can have a lifestyle that feels healthy for them. I think something that I've been talking a lot about, and so have a lot of my colleagues and friends in the past, and sometimes like when people are giving information, it can sometimes be a little bit like, well, do this, don't do that, do this, don't do that, right? And sometimes we can want to do something, but we don't have the supports around us to be able to make that choice, right? So, they might say, you really need to get more sleep, because if you get more sleep, you will be less stressed and your emotions will be more balance, and you're like, great, I really want more sleep, but I'm working 2 jobs, I have other children. It's really hard for me to get sleep. And so that's something that we're just really kind of also wanting to talk about, like that there are things that we can do as people, to take some of the advice that's given. And there are just some things that our bigger society and our communities also need to lean in and help with, right? So we know it's not good to live in a house that might have lead paint, or we know that sometimes there's trouble with water, and that's not something that an individual person can fix. And so that's something that I've had a lot of passion about, how we can kind of make sure that all of our communities are investing in health and well-being for people of reproductive age. I think the other thing is just having conversations like this. I think a lot of people don't really know that what they do before they get pregnant is really important. A lot of people say, well, once I get pregnant, then I'm going to do this, or once they get pregnant, then I'm going to get health care. And I just feel really passionate about having that start sooner, and making sure that people have information that they need to make their own decisions. I think the last thing I'll say, and this is very long, but you asked what I'm excited about. I do want to say, I know that providers work really hard, but sometimes they have opinions that they don't always keep to themselves as well as they should. And so sometimes people can feel like they don't want to tell their doctor that they're thinking about being pregnant because they fear that they might be judged, because maybe they don't have a partner, or maybe they have a condition, or maybe they don't have a lot of money, and might feel judged, so they don't want to talk to them about that. And I just want to acknowledge that some cases it may not feel safe to talk about that, and that people have a right to decide when and if they want to become parents or to have a family. So I just wanted to name that as something that's important and something that I'm trying to change the conversation about.
I really appreciate that. I have to stop you right here and just applaud you for saying something as a healthcare provider in a larger space that can be uncomfortable. You're absolutely right. None of us are perfect, and things are difficult. So I really appreciate you saying, that not every space is considered a safe space in healthcare for everyone.
Absolutely not, unfortunately.
And I'm very glad that you and people like you, other people highly passionate, motivated about this topic, are out there having these difficult conversations, spreading the word, like you said, to turn the tide and change the conversation, change the outcomes, and hopefully that's going to benefit more patients and their families.
Yes, absolutely. And I think there's so many examples, but one that I think can sometimes be a suggestion that a provider might give someone that is really hard. They often, when you go to a provider's office, they're going to weigh you. And I just think that we have a terrible way of talking about weight and weight loss, and just telling someone, well, you should lose weight before you become pregnant. That is really unhelpful. And so I think that's one example where I think a conversation should be, what feels healthy for you? How are you feeling about your weight right now? It tends to be stronger for people that are very overweight, not just people that are regular overweight, right? But we tend to lump all of that together, and then people can leave and feel sad, mad, unheard, and also frustrated, because it's really hard. It's really hard to lose weight without support. So I think that's just one example of something that wasn't in the list, because I've actually not talked about it anymore because it's so complicated. But that sometimes can be a conversation that can really trip up a trustful conversation between a provider and a person that's asking questions. So I think those are just some of the key things. And I think for mental health, we're really kind of talking about helping people understand really what happens to your body after you have a baby. And I think a lot of us don't understand that, when we're pregnant, our placentas make hormones that are like happy hormones. And when we give birth and we lose those placentas, we lose those happy hormones. And so not only as a new parent are you dealing with how your body feels, if you've got a baby with a birth defect, you're going to be extra worried about your baby and dealing with a lot of information. And the time that you need those happy hormones, they're kind of not there. And so I think some of it is for all of us understanding and loving our postpartum bodies and knowing that we might feel a little crazy and upset and sad and worried, and that's really part of being postpartum. And if those feelings continue after a couple of weeks, that we really deserve care and support to help us with our feelings and emotions.
And again, a very important point, and a little bit to the other side. So I know that, not everybody knows that there are hormones in pregnancy that are not there after the placenta leaves the body. But at the same token, there's the other piece where it's like, well, okay, I knew that personally because of my medical background. And so what it became for me was, it's just my hormones. My hormones are just not what they were. And that's all this is. And I don't have to worry about it. Just keep moving, keep going, and it's going to resolve on its own. And that is not always the case, not by far.
Exactly.
And so, having that knowledge is good. And having, I think really what you were trying to emphasize, and rightly so, is that undercurrent of please care for yourself. Not only are you so worth it just for who you are right now, every minute of the day, but if your focus is your family, which it is for so many people, that also helps them. Healthy you can help make a healthy family. And I can tell you that as a parent and as a woman, I used to be very quick to just dismiss that. It's like, nope, as long as everyone else is okay, then I'll be okay. And it's actually the reverse. If I'm doing well, then I can make sure my family is doing well also.
That is so true. Something that I feel like I learned the hard way, right? Because I'm a generally sunny, upbeat person. But every now and then at work, I would just really have a bad day. Like the universe wanted to just, make it a bad day. And I would come home, and of course, then everybody else, all of a sudden in my family, is having a bad day. And I would be like, why can't I have a bad day? And then I finally realized, I'm like, because whether I like it or not, my mood really influences this whole family. And so of course I had a right to have a bad day, but it was kind of like when I reframed and I was like, oh, wow, they're not just trying to make my day worse. They're like vibing off of me. And so I think that for me taught me like, it's okay to have a bad day, but like how I manage my bad day really matters to my family. And so I know that's a small thing, but I feel like we keep getting this lesson as our kids grow, and like someone said, you're going to keep getting the same lesson until you learn it. So if you can like learn from my lesson that I figured out, like when my kids were 16, please go for it when they're a baby, because it's a good one to learn.
And I'm going to just say, in my opinion, it's not a small thing. It's absolutely true. It's so crucial. If I'm upset because my toddler spilled milk all over my suit jacket and I'm just about to be out the door, I know now after practice, trial and error, the best way to make sure that me and she can get out of the door in one piece and go about our day. So yeah, learning the hard way. That's kind of the rule with kids, I think, but also in general, even, outside, like in the preconception, if there's never been a pregnancy, you've never had a child before, it's still one of those things, treat yourself well and gently as much as you can to just keep yourself as even as possible.
And I'm really glad that you're having this conversation. I don't think in the U.S. we're really talking as much about this topic. And I think it's really important that, people know to ask these questions and to start this conversation with their provider, with their partner. I just think there's a lot to really consider and talk about and think about and plan for and dream for. And it's kind of funny. So, my son, at the time he was 19, so not that long ago. And we were out like at a big store or something, and this kid kind of like ran in front of the car, and the dad grabbed him, or the kid was screaming or something. And my son said, he's like, when I'm a dad, my kid's not going to do that. And I was like, preconception moment. So I looked at him, I'm like, oh, so you think you want to be a dad someday? He's like, yeah. I said, oh, how many kids do you think you might want to have? He's like, one. I was like, oh, when might you want to have kids? He's like, Mom. So I got 2 questions in. But it was kind of cool, like that, you know, that he was thinking ahead. And I want to just kind of, as we're kind of wrapping the conversation, say that a lot of times this also pressure gets put on women or the, you know, person who's going to have the baby, when really, if there's a partner involved, this is really kind of a team sport, right? And it's easier for me not to drink wine if like my partner doesn't bring it home after work, you know?
Right.
It should be a shared responsibility and a shared joy if you have a partner with that partner.
Excellent. Dr. Verbiest, thank you so much for being with us today. But before you go, is there a final thought you would like to leave our listeners with?
I think my final thought is that you matter. You matter for the gifts that you have, that you bring to this world, for exactly who you are, for all that is special about you. You matter regardless of whether you have children. You're important. And I feel like that's what I want to say.
And it's a very important message. Simple, but so very powerful. Thank you again so much for being here, and we hope to have you back on a future show.
That would be fun. It's been great talking to you. I really appreciate the conversation.
Same here. And to our listeners, as always, thank you for being part of the Mother to Baby podcast. So don't forget to subscribe to the podcast so you never miss an episode. You can also go back and listen to previous episodes as well. And remember, Mother to Baby is here if you have questions about exposures. So before pregnancy, in that preconception time, during pregnancy, after pregnancy, including breastfeeding, and in cases of adoption. You can reach us by phone at 866-626-6847, by text at 855-999-3525. You can visit our website at mothertobaby.org, and there you can live chat with a specialist, or you can access our podcasts, one of our many fact sheets, and other information as well. And if you have an idea for the podcast, or if you would like to be on the podcast, please feel free to email us at contactus@mothertobaby.org. So until next time, thank you. And remember, Mother to Baby is here for you. Take care.
Mother to Baby is a service of the nonprofit organization of Teratology Information Specialists and supported by the Health Resources and Service Administration of the U.S. Department of Health and Human Services. It's made possible through generous donations from listeners like you. To learn more about Mother to Baby, please visit mothertobaby.org.